Hi, I'm Josie. I'm your nurse for today. What exactly are you doing?
I'm doing moxibustion. It's heat therapy for pain relief.
You're gonna burn her.
Well, no, this is a traditional method of pain relief.
You can't burn things in the hospital. It's hospital policy.
Well, the nurse that was on the last shift didn't seem to have a problem with it.
Well, obviously she didn't tell you about the policy and it affects other people's health.
Well, I'm not trying to hurt anybody. I'm just trying to take some pain away from my daughter. She does have cancer.
Yeah, so why isn't she taking chemo or radiation?
Well, we decided that we wanted to practice some more holistic ways and just practice our traditional Chinese medicine for her. And so far, I think that she's feeling better, and I think that it's going to be a good outcome.
There's no research that supports that this actually works.
Well, I've read some good outcomes from it from other people that have tried it, and I think that it'll really work for her.
Well, I have the medical knowledge to know that she needs chemo or radiation and not use this traditional method. It's ridiculous. It's not going to work.
Well, I just really thought that it would, and our doctor talked to us about it, and he really seemed on board with it. I was really hoping that, the nurses would kind of just be helpful with it, because I really did want to practice this.
Well, you seem to know what you're doing. I don't know where you got your medical degree, but I'm just going to leave you to it.
In the first video, we see a clear example of how not to act with a patient. It's obvious that Jose the nurse's behavior is unacceptable, but we need to ask ourselves the question why. She fails to meet her professional responsibilities in multiple ways. From the beginning, she makes no attempt to cultivate a positive nurse-client relationship. She acts disrespectfully by making her disapproval obvious. She decides that the patient is hostile by breaking hospital policy and acts hostile in return. By acting this way, she loses the trust of the client. We know that without trust, patients are less likely to cooperate, and therefore less open to exploring other treatment options. Instead of asking herself the question, what does the patient need? The nurse asks herself the question, what do I think the patient needs? This thoughtless approach to patient interaction takes away the patient's power to advocate for themselves, and ultimately leaves the patient's needs unmet.
Yes?
Hi, Brooke.
Hi.
Hi, my name is Jacob. I'm one of the nurses. How are you?
Good. How are you?
Good, thanks. I see is that smoke or
Yeah, it's actually moxibustion. It's a form of heat
Okay.
therapy. Yeah.
like a traditional medicine type thing?
Yeah, Chinese medicine, actually.
Okay,
Yeah.
there you go. Nice. Technically our policy, I just have to let you know, technically our policy is you're not allowed to have things like smoking or burning in the hospital.
Oh.
However,
okay.
we do have a smudging room which does practice traditional medicine that's available to you at any time if you're interested in that.
Oh, yeah, sure. Like, sometimes she has a hard time walking, though. Is that going to be a problem to...
No, like we have people in the hospital who can help bring them down there as well.
Okay.
Yeah, so we can
Okay,
have assistance
perfect.
along the way.
Yeah, then that would be awesome, actually, yeah.
Now, is it traditional medicine that you want to go for treatment?
Yeah, we kind of want to try and stay as holistic as possible and kind of just incorporate some different Chinese medicines for pain management and, her diagnosis was brain cancer, so we kind of want to stay away from some of the harsh things that have, like, really bad side effects. So we're trying to stay more natural,
Yeah, absolutely. However, I know that is a scary thing to think about those treatments, but the other treatment options are available. I was going to let you know.
Okay.
They're not necessarily always that damaging.
Okay.
Yes, there are some side effects. If you want more information, I can go get some pamphlets for you on that, just so you have like some learning for yourself.
Actually, yeah, I wouldn't mind looking at some of it because I'm sure like I can do both, right? Like my daughter can receive the traditional medicine and some more.
Yeah, absolutely.
Okay.
I mean, if you want to try one, you want to try the other, that's completely up to you. But I figured I can get you some information if you'd be interested.
Yeah, actually, that would be really great.
Perfect. I will go do that right now for you. Sounds good?
Yeah, awesome. Thank you.
No problem.
In scenario 2, we see a completely different outcome, which is determined by the nurse's more skillfully handled interactions with the patient. When Jacob the nurse first notices the burning plants in the room, his first thought is to make a connection with the patient and what they're doing. Without making too many assumptions, Jake is able to look beyond his own scope of knowledge and identify that the patient is practicing a form of medicine that he is not familiar with. Without chastising the patient, he thoughtfully lets the patient's mother know that what they are doing is technically against hospital policy, but he is quick to offer up a solution that both benefits the patients and satisfies hospital policies. Jake shows professional competence when he is able to quickly resolve an issue with a patient by providing an agreeable solution. It's obvious from the video that while Jake does not fully understand the practice, he is happy to help satisfy the patient's needs, and understands that they are important simply because they are important to the patients. He adopts their needs and sets them as a goal. Jake the nurse shows professional knowledge by knowing hospital policy, and by understanding the importance of the patient's actions as a cultural and personal necessity. He displays professional knowledge application when he directs the patients to the hospital smudging room and explains how they can be accommodated. Jake the nurse shows that he is able to build a therapeutic nurse-client relationship by promoting client-centered care when he listens first to the patient's needs and goal sets accordingly. Jake the nurse is collaborative, respectful, and thoughtful in his interactions with the patient, and this leaves the patient satisfied. Jake the nurse is able to complete his own professional responsibility as a teacher as well. Once he has shown to the patient's mother that he is accepting of her practices, he opens the door to impart his own medical knowledge of how best to treat the daughter. He is able to assure the client that both holistic medicine and Western medicine can be used in combination to help heal her daughter.